In this section, I will talk about mood stabilizers, antidepressants, and antipsychotic medications, which are the main classes of medications used to treat bipolar disorder. Before I start, I want to be really clear that I'm not a medical doctor, and what I'm saying should not be considered in any way to be medical advice or treatment. It's the job of the treating physician, hopefully a psychiatrist, to determine the best treatment for the patient. With that said, I want to give you an overview of the role of medication in the treatment of bipolar disorder and address some questions that frequently come up. How do medications work? Several classes of medication are used in the treatment of bipolar disorder. Mood stabilizers are usually the first choice to treat the disorder. Except for lithium, many of these medications are anticonvulsants. Anticonvulsant medications are usually used to treat seizures, but they also help control mood. While research has found that mood stabilizers are effective for treating the symptoms of bipolar disorder, it's not exactly clear how they work. Chemical messengers in the brain, called neurotransmitters, regulate mood. It's believed that lithium affects the activity of two of these neurotransmitters, serotonin and dopamine. Anticonvulsants are believed to work by increasing the neurotransmitter GABA, which has a calming effect on the brain, and decreasing the neurotransmitter glutamate, which is an excitatory neurotransmitter. Antidepressants are also used in the treatment of bipolar disorder, not surprisingly, to treat symptoms of depression. Antidepressants increase the neurotransmitters that regulate mood. Specifically, they increase serotonin, norepinephrine, and/or dopamine. Individuals who are prescribed antidepressants are usually required to take a mood-stabilizing medication at the same time to reduce the risk of switching from depression to mania or hypomania. Lastly, antipsychotic medications are sometimes used to treat individuals who are in a manic or a depressive episode. They vary in their effectiveness for treating these episodes. How long do medications take to work? All medications must be taken as prescribed. The various classes of medication will take different amounts of time to work. Let's start with mood stabilizers. After achieving the desired effective dose of a mood stabilizer, it may take an additional 1 to 2 weeks before you can expect to see improvements in manic symptoms. It may take up to 4 weeks for depressive symptoms to lessen with mood stabilizers. In regard to antidepressants, all antidepressants must be taken as prescribed for 3 to 4 weeks before you can expect to see positive changes in your symptoms. And finally, the effects of antipsychotic medications can sometimes be noticed within the same day of the first dose. However, you may not experience the full benefit of the medication for a few weeks. Regardless of the medication you've been prescribed, it's important that you don't stop taking your medication because you think it's not working. Give it time, and if you have concerns, discuss them with your doctor. What if my medication doesn't work? Sometimes the medication you first try may not lead to improvements in symptoms. You and your doctor have a lot of choices of medications, and it's hard to know which one may work best for you. This is because each person's brain chemistry is unique, so what works well for one person may not do so well for another. Be open to trying another medication or combination of medications in order to find a good fit. Let your doctor know if your symptoms have not improved, and most importantly, do not give up searching for the right medication. Can I stop taking my medication? Once you've responded to treatment, it's important to continue taking your medication as prescribed. To prevent symptoms from returning or worsening, don't suddenly just stop taking your medications, even if you're feeling better. Stopping your medication can cause a relapse. Medication should only be stopped under your doctor's supervision. If you want to stop taking your medication, talk to your doctor about how to correctly stop. However, keep in mind that people with bipolar disorder generally need to continue taking medication for extended periods of time, at least 2 years. Discontinuing treatment earlier may lead to a relapse of symptoms. If you've had a number of episodes of mania or depression, your doctor may recommend even longer-term treatment. What if I miss a dose? Here's a safe rule of thumb if you miss a dose of your mood-stabilizing or antidepressant medication. Take your medication if it's been 3 hours or less from the time you were supposed to take your medication. Skip taking your medication if it's been more than 3 hours after the dose should have been taken. In this case, just skip the forgotten dose and take your medication at the next regularly scheduled time. Never double up on doses of your mood stabilizer or antidepressant to catch up on those you have forgotten. What if you miss taking your antipsychotic medication? Most antipsychotics are prescribed once daily. If you forget to take your medication, do not double up the next day to catch up on the dose you missed. If your medication is prescribed to be taken twice a day and you forget to take a dose, here's a rule of thumb. Take your medication if it's been 6 hours or less from the time you were supposed to take it. Just skip the forgotten dose and take your medication at the next regularly scheduled time if it's been more than 6 hours after the dose should have been taken. Again, never double up on doses of your antipsychotic to catch up on those you have forgotten. Let's go over the mood stabilizers in more detail now. One thing to note is that prescription drugs go by two names, their brand name and their generic name. So for example, the brand names for lithium are Escalith or Lithabit. You can see the names of the anticonvulsants on the screen listed below lithium. The first name is the brand name, and the name in parentheses is the generic name. Like all medications, mood-stabilizing medications can have side effects. Your doctor will discuss some common side effects with you. In many cases, these side effects are mild and tend to diminish with time. Many people have few or no side effects, and the side effects people typically experience are tolerable and subside within a few days. Be sure to check with your doctor if any of the common side effects persist or they become bothersome. And definitely talk to your doctor before making any decisions about discontinuing treatment because of side effects. In rare cases, these medications can cause severe side effects. You want to talk to your doctor immediately if you experience one or more severe symptoms. The only one I'm going to talk about here is lithium toxicity. Lithium toxicity is a serious condition caused by having too much lithium in your system. For this reason, you'll need to do occasional blood tests to ensure that lithium is not impacting your kidney or your thyroid functioning. In addition, using certain pain medications such as ibuprofen or sweating a lot can cause your lithium level to increase. This is why it's important to talk to your doctor about how to exercise safely. There are also some rare but serious side effects associated with some of the anticonvulsants that will require you to have your blood checked occasionally. Lastly, I want to mention that mood-stabilizing medications can interact with other medications to create potentially serious health consequences, so be sure to tell your doctor about all the medications you're taking, including prescription medication, over-the-counter medication, herbal supplements, vitamins, and minerals. Let's move on to the antidepressants. There are 5 different classes of antidepressant medications, which I will briefly review. The first class are the serotonin reuptake inhibitors. This group includes the selective serotonin reuptake inhibitors, or SSRIs, which are the most commonly prescribed antidepressants because they have relatively few side effects. SSRIs increase the level of serotonin in the brain. Serotonin modulators are newer drugs that act like SSRIs but also affect other serotonin receptors. The second class of antidepressants are the serotonin and norepinephrine reuptake inhibitors, or SNRIs. SNRIs are similar to SSRIs in that they increase levels of serotonin in the brain, but they also increase norepinephrine in the brain to improve mood. The next class are the atypical antidepressants. In addition to targeting serotonin and or norepinephrine, atypical antidepressants may also target dopamine. The fourth class includes the tricyclics and the tetracyclics. This is an older class of antidepressants that also work by increasing levels of serotonin and norepinephrine in the brain. These medications are good alternatives if the newer medications I went over are ineffective. The last class of antidepressants are an older class called the monoamine oxidase inhibitors, or MAOIs. Monoamine oxidase is an enzyme that breaks down the brain chemicals serotonin, norepinephrine, and dopamine. The MAOIs work by blocking this enzyme. Although these medications can be very effective, they are not frequently used because of the need to follow a special diet to avoid potential side effects. Like all medications, the antidepressants can have side effects. The common side effects differ for each class of antidepressants, so I'm not going to go over them. But if you have any questions, please talk to your doctor or refer to the patient information leaflet that comes with your medication. Let's talk about antipsychotic medications next. Antipsychotic medications are often put into two different categories, first-generation and second-generation antipsychotics. Here's a list of the first-generation antipsychotics. These medications are also known as conventional or typical antipsychotic medications. Here's a list of the second-generation antipsychotic medications. The second-generation antipsychotics are also referred to as atypical antipsychotic medications. Some of these medications are also available as long-acting injectables, which are given every 2 to 4 weeks. Use of injectable medications is one strategy that can be used for people who regularly forget to take their medication. Some people find these more convenient because they don't have to take their medication daily. The side effects of these medications are similar to their oral counterparts. Let's talk about side effects next. Like all medication, antipsychotic medications can have side effects, and in many cases they're mild and tend to diminish with time. I'm not going to go over all the side effects, but I do want to review the more serious ones. Some people experience side effects that mimic symptoms of Parkinson's disease, such as tremor, shuffling walk, and muscle stiffness. Prolonged use of antipsychotics may cause tardive dyskinesia, a condition marked by involuntary muscle movements in the face and the body. An uncommon but serious side effect is called neuroleptic malignant syndrome. These symptoms include high fever, muscle rigidity, and irregular heart rate or blood pressure. Contact your doctor immediately if any of these symptoms appear. Weight gain is common with some antipsychotics. Therefore, your doctor will check your weight and blood chemistry on a regular basis. Each of the antipsychotic medications differs in its risk for causing these side effects. If you have a scale at home, you want to regularly check your own weight. If you start to gain weight, talk to your doctor. It may be recommended that you switch medications or begin a diet and exercise program. Okay, well that wraps up our discussion of medication treatment for bipolar disorder. Join me next time to talk about how family members can help their relative with the disorder.